The U.S. Senate will not be voting on a bill to repeal and replace Obamacare this week. The vote is being delayed because Senator John McCain had surgery and has to stay in Arizona all week. As Senator McCain recovers from the removal of a blood clot from above his right eye, Republican leaders will have more time to convince their own members who are not convinced the bill is a sound one. Meanwhile, Democrats say the measure will cripple states by slashing Medicaid funding. The Minnesota Department of Human Services is estimating Minnesota would lose $2 billion in medical assistance in the first 18 months, and by 2030, the funding losses would top $30 billion. Joining us to talk about her concerns and the state's concerns, the Commissioner of the Department of Human Services, Emily Piper. Thank you so much, Commissioner Piper, for coming in.
Thank you for having me.
All right, let me ask you about these estimates, because they are staggering. Republicans say we're not really cutting Medicaid, we're merely changing the program to make it forms of block grants. Are these figures including the estimated block grants that Minnesota will receive?
They're estimating the per capita cap that Minnesota would receive under the Senate bill and the House bill. And I think one, thing that is particularly challenging around trying to explain this is our programs grow because the costs of health care grow, and the cost of providing nursing home services for people with disabilities or seniors all across the state just grow automatically, and we know and can predict how much that growth is going to cost, and we do that now. And so what this does is just caps the amount of growth that the federal government is willing to contribute, knowing that the growth is far more significant than that.
All right. And Minnesota was one of the states that expanded Medicaid under Obamacare, as did many Republican-led states, and some of these Republican governors are expressing concern too. Are we going to get hit harder, in your opinion, because of the Medicaid expansion here?
Yes, I think we will get hit harder, as will the other expansion states. We also are uniquely punished in that we're only one of two states that has a basic health plan called Minnesota Care, and about 85,000 people every month get insurance. They're really the working poor in our state that don't quite qualify for Medicaid, and this both bills completely defund Minnesota Care, which is about 88% federally funded this year. It's a $500 million program.
All right, and how many people on Minnesota Care?
About 85,000.
Okay. And you're saying completely defunded?
Completely defunds the federal share, which is 88% this year of the whole funding for that program.
Republicans argue that their proposal will stabilize the insurance markets, which under Obamacare the lack of stability has led to just skyrocketing out-of-hand premiums for those on the individual market. What do you say to that?
Well, I'd say a couple things. First, I'd say that the two largest insurer representative organizations nationally just came out in opposition of the Cruz amendment that's currently being considered as part of the Senate bill, and also have voiced really significant concerns for the bills themselves. Additionally, I would say with respect to the Senate bill, it actually penalizes people on the individual market in Minnesota more than they're already facing in challenges now with the increases in premiums. For example, it reduces the level of tax credits that people on the individual market can access. And just for a person example, in Candy-Ojai County, a person making $50,000 a year is 400% of federal poverty. Right now, under the ACA, they would get $9,600 in tax credits if they bought insurance on the individual market. Under the Senate bill, they would get $0 because they'd make too much money. And so I think it actually penalizes, and I think it's borne out that it penalizes people on the individual market and on Medicaid more than any other segment.
Okay. You have the biggest budget in the state of Minnesota in terms of the department. What kinds of contingency plans are you making? Because this could pass. We don't know. It's going to be very, very close. What kinds of contingency plans are you making to try and deal with this?
Well, I think we're going to see the effects of the instability, and we're already seeing them in Washington right now, and the rates for the individual insurance market will come out at the end of this month, and we'll see insurers very nervous across the state about what's happening in Washington, regardless if something passes by then. At DHS, fundamentally, it's about the people we serve, 1.2 million people every month that receive their health care through Medicaid. And although the president says it's complicated, at the end of the day, cuts aren't as complicated as you would think. We'll have to go through contingency work groups and things like that for legislative proposals this year, but ultimately it comes down to what benefits are you going to cut, who are you going to cut off your programs, and what provider rates are you going to cut, because that's where the bulk of the funding goes.
Okay, well, Commissioner Piper, obviously we'll be following these developments. Thank you so much for your time this Sunday morning.
Thanks for having me.